Everybody, it's Dr. Randy with Custom Family Chiropractic. Today I have Chelsea in the office. Chelsea came in yesterday with an insidious onset of left shoulder, left neck pain. Insidious meaning she doesn't know how it happened. She thinks maybe she slept wrong. So we're going to just show you how we treat that, how we adjust it, some of the soft tissue we work on. And is it giving you a headache?
No.
Not a headache, just sharp if you want to get in here, Ash. She's getting pretty severe, basically left shoulder pain. Here's her scapula on the left, and then her levator scap muscle attaches to this superior medial border of her scapula and then runs up into her neck. And that's almost pinpoint where a lot of her pain is. She also has, so her left trap muscle, the middle fibers of her left trap, her rhomboids involved, and she has thoracic spine restriction, cervical restriction, so we're going to take care of all that today. And that's typical for us on a treatment. Patients that come in to see us, we're going to not just adjust them gently, we're also going to work on their soft tissue, do like a little, almost like a mini targeted massage or trigger point work on the muscles that are involved. So slide down for me a little bit, Chelsea. How'd you feel after your last visit?
I could move.
She came in yesterday, she got a little better after one visit, and so hopefully this one, she gets even more relief. We may have to see you next week one more time, too. So before we adjust her, I'm gonna take some lotion and work on the muscles here a little bit. All right, so I'm just doing trigger point work on that levator scap muscle and kind of on her trap. And I feel some of the inflammation, the pockets of inflammation, and we're just kind of holding what's called ischemic pressure. So we hold pressure, and then as we take our hand off and relax, that allows blood to rush into that tissue and flush out some of the inflammatory stuff that's causing a lot of the pain. Pretty tender.
Mm-hmm.
That's tender. Super common area of the body that we see in the office where there's pain is this transition area between the cervical and thoracic spine. The curve of the spine changes. It puts a lot of added stress there just naturally. So it's hard to see there, but I'm just kind of getting in onto that left superior border of her scapula, that wing bone there. Take a nice deep breath in for me. Just relax your arms all the way down. Exhale. So that moved good. That's basically two T thoracic spine, 2, 3, 4, 5, 6 kind of moved. And then we're gonna adjust T1 up here. Relax your shoulders. Good. It's a little different type of adjustment. And I'll even hold some trigger point work into her left scapula a little lower. Is that tender?
Mm-hmm.
Her whole left shoulder is tender. How about out here? Not so much?
No.
Okay. All right. Go face up for me. Now we'll adjust your neck and that'll be it. So far, so good.
Yeah, that's good.
So some of those muscles we talked about, the levator scap, even some fibers of the trapezius muscle run up and attach to the upper neck, you know, and then her scalenes and suboccipital muscles in her upper neck are tight. She's definitely restricted up here, both sides. So just a nice, easy. It's her left that was bothering her, so we're gonna hit that side first. Just relax your shoulders for me. Perfect. So I've been saying this a lot in a lot of the videos, but the adjustment gets those muscles to reset. It resets the proprioceptors and the mechanoreceptors that are on those joints. And that moving your spine on an intersegmental level through a full range of motion helps drastically bring down pain, inflammation, swelling, scar tissue. So we're really getting to the root cause of it, not just taking an Advil or a Tylenol and masking the symptoms for a couple hours. This is going to get to the root cause, prevent scar tissue buildup. Just relax your shoulders again. Perfect. So she moved good. I'll probably do a little more soft tissue here and a little more stretching, but that'll be it for today's video. Thank you for watching. Bye.